Hi there, this is Jen Chandler from Congressman Jim McGovern's office. Thank you all for taking the time to join us today. We're going to get started in just a few minutes. First of all, I'd like to provide a few reminders at the top of the call today. If you have a question at any time, please press *3 and an operator will help assist you. We anticipate a large number of questions and we won't be able to get to everyone, but we will get through as many as we can. Next, I will announce your name and where you're calling from, and you will be on the line to ask your question. Please be sure to listen for me to call your name, and please state your question as briefly as you can so we can get to as many as possible and be respectful of everyone's time. If you would like to sign up for Congressman McGovern's newsletter to get the latest updates on his action to combat the coronavirus, you can do so at mcgovern.house.gov. You will also find on Congressman McGovern's website a list of local and state resources that are specific to Massachusetts to help you and your family during this difficult time. I'd like to remind everyone that if you have a question for Congressman McGovern or any of our guests, you can press *3 at any time and an operator will help assist you and put you in line to ask a question. We will get to as many people as we can until the call ends. Looks like we now have enough people on the line to begin the town hall. I'd like to welcome Congressman McGovern. Go ahead.
Well, thanks. Hello, everyone, and thank you for joining us for this Teletown Hall. Every spring I hold coffee with your congressman gatherings all across my district, in cafes and in bookstores and in restaurants and in town halls. I sit down with folks to listen, learn, and answer questions. Sadly, things are different this year. I miss those face-to-face interactions, and I can't wait to get back to doing them again. For so many of us, the last few months have been extremely challenging, and I've been experiencing it too. Not being able to have dinner with my mother and not being able to, again, meet with people in person has been challenging. So even though we've shifted to teletown halls, this is still an important opportunity for me to hear directly from you and to try to answer any questions that you may have. First, I want to take just a moment to talk about the murder of George Floyd in Minneapolis. I have to tell you that I watched the video and I was sickened, and I'm sure you were too. What happened to George Floyd was wrong. It was unjust, and we must demand accountability. But more important than that, we need to channel our outrage and our anger into action and legislation. This was not a one-off incident. Racism is a reality in this country. The fact is, if George Floyd looked like me, I have no doubt that he would still be alive today. Systematic injustice that specifically affects Black Americans is a reality in this country. And it is on all of us, even those of us who mean well, to be honest with ourselves and others about how we can root it out. Second, let me just say a few words about the pandemic. Last week we passed 100,000 coronavirus deaths, including over 6,000 in Massachusetts. This is a tragic and terrible milestone, and we mourn for all of those who have been lost. 100,000 is not just a number. It's empty seats at dinner tables. It's moms and dads missing graduations and weddings. It's grandparents who won't see their pride and joy grow up. So while we all want to reopen in a responsible way, we also have to remember that this is a very serious virus that we're dealing with. This is not the flu. We have got to take this very seriously. We also need to reopen in a way that is sustainable, because I think the worst thing that could happen for us is to reopen and then have another spike that leads to even more deaths and then another shutdown. So that is why tonight we have two officials from Governor Baker's Reopening Commission to talk about the reopening process and answer some of your questions, as well as Chancellor Collins of Umass Medical School, who can talk about any of the medical questions about this virus. So having said that, I would like to welcome to the call the Massachusetts Secretary of the Executive Office of Housing and Economic Development and co-chair of the Governor's Reopening Advisory Board, Mike Keneally. And Mike, why don't we begin with you?
Well, Congressman, thank you so much for organizing this call and having me be here today. And thank you as well for your leadership in getting critical federal aid into the Commonwealth during this time. Federal support has been essential in battling the pandemic and its impacts on the Commonwealth, and will be vitally important throughout reopening and recovery. Also, a big thank you to Mayor LaChapelle, who is such a terrific member of our Reopening Advisory Board, and thanks to Chancellor Collins for your leadership during this challenging time as well. So I'm Mike Keneally. I serve in Governor Baker's cabinet as the Secretary of Housing and Economic Development and served with Lieutenant Governor Polito as co-chair of the Reopening Advisory Board. The governor tasked us with delivering by May 18th a strategy to develop a careful, phased approach to reopening the Commonwealth's economy. And it's important to note some context as we approach the work. We were among the hardest hit states in the country by COVID-19. By most metrics, we were third behind New York and New Jersey. And so it was incumbent on us to develop this careful, phased, data-driven approach to how we're going to reopen. And we were quite broad in our outreach as we approached the work. The reopening board was about 17 members, 3 from municipal leadership, including Mayor LaChapelle, 3 from the healthcare community, and 11 from industry, representing a diverse array of sectors and geographies around the Commonwealth. And that group met with 75 different industry associations, labor groups, and community coalitions, representing 112,000 businesses and more than 2 million workers across the state. So we got a lot of great input. And I'd say there's really a few things that drove our work. One is what were going to be the health indicators that would tell us when it was safe to reopen and safe to go on to future phases of reopening. And it is a 4-phased approach. Second, what were going to be some of the mandatory safety standards we thought would be important across all workplaces and all activities to operate as safely as possible in this new environment. Third was trying to determine what industries, what activities, what workplaces could open in each phase with a assessment of what is the health risk of opening one of those activities and being careful about which activity we're opening in each phase. Another part of the work was determining what are the specific industry and workplace protocols by industry and by workplace that would be important as those areas open. And finally, spending a lot of time on the critical enablers of getting back to work, like transportation and child care and others. So we have this 4-phased approach. I encourage you to take a look at our website, mass.gov reopening, which has our strategy report there, as well as a lot of information about the industries that are open now and what their industry protocols are. And we look forward to working together to get us through these 4 phases and delivering as safe as possible reopening.
Thank you. Thanks, Mike. I would now like to welcome Chancellor Michael Collins from Umass Medical School.
Good afternoon, Congressman. Good afternoon to your constituents. And it's very nice to be with you and with Secretary Keneally and Mayor LaChapelle. Let me thank all of you for your terrific leadership during this very challenging time. I think one of the points you made, Congressman, as you were beginning, is one I would like to emphasize, and that is the seriousness of this virus. Many people look at this and say, well, I know someone, it didn't seem like it was that bad, or it didn't affect young people, or in many other ways, just to sort of, dismiss. I've talked to so many people say, look, I just want it to be the way it was. If you look at CNN or the numbers every day, you might see 1,700,000 people in America have been affected by the disease and over 100,000 dead. Let's just say that number is off by a factor of 20. And let's multiply that by 20. So 1.7 million times 20 is 34 million people. If that's true, and that many people have had it, it still means there are 300 million people susceptible to the disease. And we should be very cautious about that. At our medical school, we have 19 labs working full-time to try to create a vaccine, to look at other drug treatments that might be used to combat the disease. And we're and perhaps during the call, I'll be happy to talk about some of those efforts. I might say one other thing. Today was commencement day at the medical school. We had graduated our medical students early, but today we graduated our nursing students and our graduate students. Those students will go on for careers in science. It's always a very exciting day. It was very sad for us that we had to do it virtually. But Congressman, I was thinking back to 2014 when you came to campus and gave a commencement address. And on that day, you spoke about the importance of our nation's biomedical research effort. You talked about the importance of investing in that effort. Had we heeded your words in 2014, we might be in a very different place today. And I want to thank you as one of Congress's big leaders in the support of biomedical research.
Well, thanks, Chancellor Collins. I appreciate it, and thanks for your leadership. And finally, I want to welcome Nicole LaChapelle, who is one of 3 mayors appointed to the Governor's Reopening Advisory Board, and Nicole is the wonderful mayor of East Hampton. Nicole, I turn this over to you.
Thank you, Congressman, and thank you for your leadership in your district and for Western Mass down in D.C. You're always just such a strong advocate, and you really get it, what it's like to be a mayor and what it's like to be out in Western Mass. Secretary Keneally, thank you for your leadership with the Lieutenant Governor on the advisory board. What an experience. I describe it as graduate school in 40 hours. And I would choose going through law school again as far as work and just digesting all of that material. And I know a partner, and we saw just the great work of Umass Worcester, and thank you so much, Michael, for just leading that always great institution to just new heights. And it's very accessible from Western Mass. I'm mayor of a city of 16,000, and when we were going through the health metrics that might be used in listening to all of these industries, what the most striking thing to me was just how delicately we're all connected. So I think about the schools in my little city and how quickly those students and families are coming from all over the world to our boarding school in town. And with cannabis, we have folks from all over. So the guidelines are just, certainly we'll talk about how they go, but really basic. We can do this.
Well, thank you very much. I appreciate it. And I think we're now going to go to questions, and we're going to, I may just assign one of the questions to one of you because you may be better qualified than me to answer it. So we're trying to get through as many as we can. So why don't we begin?
Thank you. Just a quick reminder to everyone, please press *3 if you have a question. We'll now take our first question. We have Dee on the line from Worcester. Dee, your line is open.
Hi, Dee.
Dee, are you there?
Well,
all right, we'll go to the next one.
Oh, you here? Okay, Dee, go ahead. All right, okay, well.
We'll come back to you.
All right, we'll come back to you, Dee. We have Thomas from Northborough. Thomas, you're live on the line.
Thomas?
Hello, yes.
Yes, you're on.
Yes, I'd like to know why they're abusing the HIPAA law in order to hide facts in regards to the coronavirus.
Chancellor Collins, do you want to take that?
Could you say it? I couldn't hear the question, please.
I think you're saying
I'd like to know why they're using the HIPAA law to hide facts about the coronavirus.
Well, I don't think we're using the HIPAA law to hide facts. HIPAA is a law which protects information about individuals. And so if Mary Smith or Tom Jones have coronavirus, it isn't necessary for us to know that Mary and Tom have it. What's important for us to know is that there are 2 cases, and that one is a 40-year-old woman and another is an 80-year-old man. But to take a person's information and de-identify it helps us to manage the virus. But knowing an individual person who has it is really violating the confidentiality which should exist between a patient and their caregiver.
Thank you.
All right, we'll go ahead and take our next question. We have John from Worcester. John, you're live on the line.
Hello, my name's John Bradford. I live at 70 Southbridge Street in Worcester. I would like to know, I have doctor's appointments that I set up 6 months ago. Will I be able to attend them in July?
Well, Chancellor Collins, I think you may be better qualified to answer that than me.
I think the answer is yes. Most non-COVID related medical care is coming back, if you will, so that appointments are being held. There was a time when we weren't able to do that because the healthcare workforce was fully, fully engaged in taking care of COVID-related disease. But now I think appointments are up and going, and there is some triaging ongoing so that we're trying to get people that really need to be seen first. But I think the best thing for everyone who has appointments coming in the next few weeks or certainly in the next month should just, give a call into their provider and be sure that the appointments are on. But I think the answer to the question should be yes.
Thank you.
Just want to remind everyone to press *3 if you have a question. Next, we'll go to Ms. Lynn Williams from North Grafton. Ms. Williams, you're on the line.
Hi, yes. I do have a question as far as employee rights go. My significant other worked for the city of Framingham as a custodian, and one of their coworkers was diagnosed with COVID-19, and they were not notified of his diagnosis until days later. What is an employee's rights as far as, I thought that they had to be quarantined for 14 days after the employees that worked with that positive patient person.
Yeah. Well, this is Jim McGovern. I guess let me just say that, I don't know all the specifics of that case, but the Attorney General, Maura Healey, has a fair labor hotline that she's established. And I would recommend that you call that number. It's 617-727-3465. That's 617-727-3465. And for any issue where an employee thinks that his or her rights have been infringed upon or violated, that is where I would start. So I would suggest that you call that number.
Okay.
Thank you.
Thank you.
Thank you. All right.
Thank you. We'll take our next question from Michael Wilson from Oxford. Michael, you're live on the line.
Hi, how are you today? How are you doing, sir? And I just want to thank Congressman McGovern for the hard work he's doing in Washington. He's absolutely fantastic. And we're
Thank you.
Proud.
I appreciate it.
Awesome. Thank you. My question is with children with special needs. My question is, what can we do as far as trying to get kids up to speed with their IEP and ABA therapy? Because children with special needs has obviously lost a lot since this shutdown, with the shutting down schools in March. And I believe if we wait till September, things are just going to continue to, children are going to continue to fall behind. And I'm wondering if there's any way to try to get summer school or some type of help for these children.
Let me yield to Secretary Keneally or Mayor LaChapelle on that one.
Yeah, I'm happy to jump in on that one. We're going to have a lot more to say about K through 12 of all kinds in the coming weeks, including summer school. So please stay tuned for that. But I do appreciate the concern you raised. It's one we share as well.
No, thank you, and I appreciate everybody's help on this issue.
Go ahead, Nicole.
I would just jump in on the local level. What we're doing right now is we're holding our IEP and 504 meetings via phone call or Zoom, and then engaging with our behavioral modification teams to do some Zoom, but even social distancing activities and structured learning opportunities with our students here in East Hampton, just to keep the structure and know what we're going to be needing in whenever school comes back in. So we're trying to do what we can do to keep people connected.
Thank you.
Our next question comes from Dr. Marilyn Montauk from Sterling. Dr. Montauk, you're live on the line.
Hi, this is Mari. Congressman McGovern, I appreciate greatly all the work you've been doing for us for the many years. I used to work with your sisters in Worcester in the past, and I just really appreciate everything. And I just was questioning if you have any update for us on the HEROES Act.
Well, as you know, we passed it in the House already, and we're awaiting the Senate Majority Leader to announce when he might schedule consideration of a similar bill in the Senate. I mean, or at least begin the process of negotiating with us on something that they think they can passed in the United States Senate. We haven't been given a specific date yet, which is very frustrating. But I think the good news is that Mitch McConnell has finally said that he believes that the Senate has to act on something. So I can't give you a specific date. I think they should. I think this is an urgent matter because in the HEROES Act, by the way, there is additional support for small businesses, for individuals, but just as importantly, and I think the Secretary and the Mayor would also agree with me, is direct assistance to states, cities, and towns. Our state and our cities and towns, have lost revenue as a result of our economy shutting down, and we don't want them to be in a situation where they have to cut essential services, things that are absolutely necessary for the people of our Commonwealth and the communities that we all represent. So I guess the good news is that the Senate Majority Leader has said he's going to deal with it at some point. The not so good news is that we don't have a specific date, but we're putting pressure on him. So thank you.
Thank you. Our next question comes from Lisa from Northampton. Lisa, you're live on the line.
Hi, Lisa.
Thank you. Thank you, Senator. My question is, how can we trust the guidelines that are coming out now since President Trump has pretty much whitewashed what CDC can tell us? First it was wash everything, all this. Now, who knows?
Right.
I don't know that I can trust the guidelines now.
Right.
Because they're whitewashed.
Right. And I hear you on this, and it is really frustrating that we're not all reading off the same sheet of music when it comes to what we need to do to make sure that we reopen safely. And I don't know whether the Chancellor or the Secretary or the Mayor might want to comment, but let me just say this. I would listen to what the state and our cities and our town are telling us to do. I would listen to the best medical advice of the doctors, the people who know how best to prevent this disease from spreading. And again, I think we need to rely on the experts and those closest to our communities. I think it's unfortunate that the President is not being consistent and giving advice that, quite frankly, is bad advice. Whether it's taking hydroxychloroquine or injecting yourself with disinfectant. I mean, the bottom line is. But I'll yield to the others. I don't know whether the Chancellor or the Secretary or the Mayor may want to add something to that.
I would say the following, Congressman. I think that the dedicated health professionals in the country, like our own Dr. Burrell, the Commissioner of Public Health, and the many, many, many committed clinicians, physicians, nurse, epidemiologists at the CDC, these are outstanding public servants. And by looking at the website of the CDC, I don't think we have to worry about the truth of that information. What is said in public meetings and things like that, in press conferences and things, sometimes it gets a little, sometimes it's hard to know exactly what the translation is. But I do think that the reliable sources of information in the information coming out of the CDC and the very committed health professionals there is information that we can rely on. And I agree wholeheartedly with you that we have outstanding public health leadership in the Commonwealth, and we should pay close attention to that.
I appreciate that. Yeah, and I think what Lisa is concerned about is that that there was guidance out there that about when we reopen our churches, that there needs to be social distancing, and that this could be spread through loud singing and through flyers, and apparently the CDC was warning about that, and then they kind of pulled back on some of their warning. It appeared to be under political pressure. But I agree with you, Chancellor. I think most of what we're getting from the CDC is accurate. And look, I mean, listen to the people who know what they're talking about, not the politicians. Quite frankly, it's the health professionals, it's our public health departments, and so I appreciate the question.
Congressman, if I could just jump in just very briefly and tell you what we're trying to do at the state level, which is provide the best advice we can provide, informed by some of the truly world-leading medical professionals here in the Commonwealth, and be very transparent about data. what is the experience of the virus here in the Commonwealth, and develop a very clear set of standards that will be helpful to people. So that's what we're trying to do at the state level here.
Thank you.
I would just say on the local level, Mass DHP has just been, Dr. Burrell has been great. My health agent has a question or a resident has a question. They're clarifying, and we can really rely on the state info. Very prompt, very helpful.
Thank you.
And just a reminder to everyone to press *3 if you have a question. Our next question will come from Dr. Schulman from Amherst. Doctor, your line's open. Dr. Schulman?
Hello, can you hear me?
Yes, you're on.
Thanks, Congressman. I'm a small business owner, and I went through a rather lengthy process of review with the PPP program, which generates an estimate of what you qualify for a loan, and then at the end of the process, I was told the amount was too small. It was just under $10,000. It would have made a difference to get the loan. It's been a really hard year for the business. I don't understand why there's a threshold of being too small for a PPP loan.
Secretary Keneally, do you want to respond to that at all? Or?
Well, I'm not sure I've got a great answer for you in that one. It's a program developed by the SBA, and the requirements are a combination of what's in the statute, the law that enabled the PPP program, as well as SBA regulations. And I do want to make note of that because we're trying to work here at the state level, while it's not our program, is understand how well it is helping our small businesses and understand where the gaps are. So we made a number of suggestions to the SBA in that regard. I will take a close look at this issue around the size of the loan and see what we can do there. But it is, we recognize there's been a lot of money that's come into the state from the program, but there clearly are some gaps. So we'll be mindful of that as we go forward here.
And Doctor, let me just suggest that maybe if you could give my so you're in Amherst, why don't you give my Northampton office a call, 413-341-8700. That's 413-341-8700. And let's get the details, and then maybe we can talk to the regional administrator of SBA to see whether we could be more helpful. All right?
Thank you, Congressman.
Thank you.
Thank you. Our next call comes from Diane from Halifax. Diane, you're on the line.
Hi, Diane.
Hi. Hi, and thank you for what you're doing in Washington. You're killing it.
Thank you.
We need you.
Thank
My
you.
question is, you're welcome, it's regarding adult children. They're my adult children who have disabilities and attend different day hab programs. I hear a lot about potentially when colleges are opening and public schools, a lot of talk about summer schools, but I've heard nothing about adult people with disabilities day hab programs. Any idea when they might start to begin to open, or are they on the schedule? I can't decipher from the phases.
Okay. Mike or Nicole, do you want to take that?
Yeah, that is. Oh, I'm sorry. Go ahead, Mayor.
Oh, I was just going to, we've been working with providers around Western Mass and Hampshire County about helping families and getting the structure back, but also meaningful activities and programming. And it has been a challenge, to say the least, but we're doing some stuff online, and with things slowly reopening, taking walks, and getting folks back to their community jobs has just started, and it's been a tremendous relief to the families. Secretary?
Yeah, I was just going to add, it is on this list of items, including K through 12 and higher ed, that we're going to be having more detailed guidance on in the coming weeks.
Yeah. So anyway, I think we don't know for sure.
Right.
But again, stay in touch with my office, and we will pass on the guidance that comes from the state. Okay. Thank you.
Thank you. Our next question will come from Paul from Amherst. Paul, you're live on the line.
Hi. Very quickly, on a side note, since I've retired from teaching at East Hampton High School, I'll be glad to serve on the high-speed line, but that's not my question. My question has to do with testing for antibodies, whether it's worth it or not. Namely because my wife came down with COVID in early March. She wasn't tested because they did not have any tests, but we know that she had it. I probably had it as well with no symptoms, and her father came down with it later on, but they also refused to test him for COVID, even though he had fever and pneumonia and everything else while I was in the hospital. And even though he did recover, but still ended up dying on the 27th of April, therefore we can't have him tested for antibodies. It seems like it'd be good data to know that my wife and I went through it and would add to the numbers of people that survived it. But, I've heard people say it's not worth doing the antibody test because it's not reliable.
I'm sorry that you've been through all this. So let me turn this over to Chancellor Collins.
Let me too express my condolences to you and your family. I think we need to be cautious about antibody testing at the moment. There are both specificity and sensitivity metrics for each test. And not all the tests have high enough specificity and sensitivity at the moment to act upon them. So you could get the test, but if it's not one of the FDA-approved tests, if it's not done in a reliable lab and it doesn't have a high enough specificity and sensitivity, it may not really give you any added information, which is why you're hearing some about the caution. And I think another thing that we need to be cautious about at the moment, early in a disease, even if you knew you had antibodies, I can't tell you just yet whether those antibodies are going to prevent you from getting the disease again. So what do I mean by that? Well, think about the flu. You have it one winter, and then when it comes to the next winter, you can get it again. Even though you might have antibodies to influenza, you can get it again. So I would be cautious about getting a test and relying on it, or saying, well, okay, I have antibodies, fine for me to go out to dinner, because that would not be, at this stage of the game, that would not be a good way to act. Now, look, the testing is getting better. We are likely to get to a point where we have very specific and very sensitive antibody testing. Hopefully it'll be specific, sensitive, and at a price people can afford, and that would be the time to think about getting it.
Right. Well, my purpose was not to be going out. We are still staying at home, except for once a week food shopping. So we are, staying in place and following all the guidelines, irrespective if we think that we already had it.
Yeah, that's definitely prudent. At this, I'm very cautious about, relying on anything at the moment with respect to, because we're so early in our knowledge about this virus.
Thank you.
Thank you. Our next question comes from Joseph from Worcester. Joseph, you're live on the line.
Hello, can you hear me?
Yes, we can.
Yes, thank you so much, Congressman, for these town halls. They're awesome.
Thank you.
They're awesome. Yeah, and by the way, Kim does a great job running things. She's a great coordinator.
Thank you.
Yeah, we missed you at church today, by the way, but we understand you need to be in Washington.
Yeah, well, I'll maybe see you next week.
Yeah, and it's good. Chancellor Collins was a classmate of mine at Holy Cross, so it's good to have a mini Holy Cross reunion. Couple of things. First off, and I think Kim told me, but myself and other people, we haven't gotten that $1,200 stimulus check. We should contact your office. That's what we should do.
Yeah, so if you're in Worcester, 508-831-7356. If you're in the Northampton area, it's 413-341-8700. Or I have an office in Leominster at 978-466-3552. So just, call the office and we can help try to track down where your check may be. Okay?
Okay, next comment, and thank you for that information. Just to reiterate what Chancellor Collins said, and I'm glad he said that this virus is serious. Just a comment, I am furious that we have so many people out here who aren't taking this as seriously, and you see people who should know better on social media who are not taking this virus as seriously as they should. I see a lot of people out there not wearing masks, they're not keeping distance. It just infuriates me. It really does. And you know, I'm glad to see Chancellor Collins said, you know, this isn't a case of the sniffles. This is a serious virus. And
you're absolutely right. You know, people refer to the Spanish flu of 1918, and I remind them that during the fall, that's when it got worse. So we went through a period like we did now, and then it got worse in the fall. So we need to make sure that we're taking this seriously, following all the best medical advice, continuing to wear a mask in public, continuing physical distancing, continuing to wash our hands. And if we do that, you know, hopefully we won't see a resurgence like they did back in 1918. So this is serious. You know, this is not just, you know, the flu. Like I've heard some say we've already lost 100,000 people, and it's probably higher than that. And it's, you know, and we're just approaching June. So thank you.
Thank you. Now we're going to take a question from our online submission form. We have a question here from Nona. She says, my husband and I are in our 60s and we enjoy playing cards with friends. We haven't since the pandemic started. When can we do this? It's only with another couple once a week. Thank you for all you do. Thank you, Nona.
Chancellor Collins?
Well, you know, gatherings of 4 people where you wear a mask, where the other people have no symptoms, and when you're 6 feet distant from each other are probably safe at the moment. But there's a lot, I gave you a lot of ifs there. So I think you'd have to wear the mask, should be 6 feet apart, so you might need a big card table. And be mindful of your symptoms. You know, have you had a fever, sore throat, any effect to your smell or taste, any cough, you know, the symptoms that, but I think people in groups of 4, as long as they're socially distancing and wearing a mask and aware of their symptoms, is probably okay.
Thank you.
Thank you. Our next question comes from Jamie from Northborough. Jamie, you're live on the line.
Hey, it's a real honor, Congressman McGovern. You doing this. It's an honor to get to speak to you. I'm a small business owner, and I really appreciated the swiftness in getting the PPP loan taken care of and getting that money out to us. I'm one of those who was closed. I have a gymnastics school, so it's kids. It's it's one of those probably higher risk endeavors. My question, though, comes with, because you guys were so diligent and quick in getting that money out to us, yet Massachusetts ended up being one of the hardest hit. My 8 weeks is going to run out definitely before I can open again. But I'm going to have money left over that I'm either going to end up, having to pay a loan on, or my request, I guess, to you, Congressman, is you guys could talk about some sort of extension, like a 10 to 12 weeks. I could continue to pay my staff, which is what I'm doing with all that money. I got them off of unemployment, I got them on payroll. They're doing Zoom classes with the kids, just to keep the kids moving in their homes. But I'm fearful that all of a sudden that 8 weeks is going to end and bam, we're back to ground zero again,
Yeah, no, I hear you. So on Thursday, in the House, we passed in a bipartisan way what we call the Ppp Flexibility Act, which I think reflects some of the needs of small businesses on Main Street that we've heard a lot from. And it would increase some flexibility and access to PPP loans, including allowing forgiveness for expenses beyond the 8-week covered period to 24 weeks and extending the rehiring deadline. It would increasing the current limitation on non-payroll expenses such as rent, utility payments, and mortgage interest for loan forgiveness from 25 to 40%, extending the program from June 30th to December 31st, extending loan terms from 2 to 5 years, and ensuring full access to payroll tax deferment for businesses that take PPP loans. So we're now, again, we're told that the Senate is looking with some favor upon what we did in the House, so we're waiting for them to act. And hopefully if there are any additions or changes that we can reconcile them quickly. But that's what we passed on Thursday. And again, we're waiting for the Senate to do something. I think they will. So I think there'll be some more flexibility in the program, which will, I think, be helpful to a lot of businesses. So thank you.
Wow, thank you. That is a huge encouragement for me to hear. I really appreciate you doing that. Again, I thank you for your time and for all your hard work. Thank you. That's a huge,
thank you. Good luck.
Huge boost of encouragement. So thank you. All right.
Bye.
I'd just like to remind everyone to press *3 at any time if you have a question. Our next question will come from Evelyn. From where? Evelyn, you're live on the line.
Hi, Evelyn.
Hi, can you hear me okay?
I can hear you perfectly.
Okay, excellent. Like so many others have said, I want to thank you. You're this whole state, everybody that I've been in touch with, from the governor to you guys, have just been fabulous. And if the state was used as a model for Washington, we would be so much better off.
I agree.
Anyway, but my question has a little bit to do with that in a way. I used to find listening to Dr. Fauci, even when the news was very bad, comforting, because it was clear information, and I felt like I could trust him. And then, he got faded away, and then somebody removed Dr. Brick's spine, and now I'm wondering if there's any chance that Dr. Burrell could do something similar for our state, even if it's just on the website of, this is where we are. This is where we are in the phases. This is how many steps backwards we've had to go. That kind of, do you understand what I'm asking?
Yes. So Secretary Keneally, why don't I give that to you?
Sure. I very much appreciate the comments about our great state, of course. I will say, the governor does a daily briefing now for some time on the state of the virus in Massachusetts, what the numbers are, what the trends are, and Dr. Burrell is certainly part of that and helps inform that work as well. We also, now that we're in the reopening phase, have a dashboard, if you will, that shows on a green, yellow, and red framework where we are on the various data points we think are important. So I'm hopeful between the daily briefings by the governor and this daily release of data, by the way, in addition to this dashboard, that folks are going to get what they need in terms of understanding the state of the virus, if you will.
Thank you. Thanks.
Thank you. Our next question will come from Peter from Webster. Peter, you're live on the line.
Hey, Peter.
Hi.
How you doing?
I'm doing okay. I'm a disabled veteran from Vietnam that you've helped in the past, and I otherwise think you're just doing a sparkling job in Washington. Keep it up.
Well, thank you for your commitment to our country. We appreciate it.
Two parts. One is masks. It seems to be a political divide. How do we get past that? Because I understand that if we get enough people wearing masks, it has a pretty good impact on it. And secondly, we're coming back from Florida in a couple of weeks. Are we still required to isolate, quarantine for 2 weeks? We've been quarantined here basically for 3 months.
Chancellor Collins, you want to take that?
Yes. So with respect to the masks, let me put it this way. I see mask wearing as a statement of respect for others. By wearing the mask, you're not really helping yourself. You're preventing spreading of disease from one person to another. So if we have respect for each other, all of us would wear masks. And just think if you went into the operating room and you looked up and your surgeon didn't have a mask on, how you would feel. You'd feel pretty bad about that, huh? And that's how people should feel now, that when they're out and about and they're going to come in contact with other people, they should be wearing a mask and do so as a sign of respect. With respect to the coming back from Florida, I think the guidance that the governor has given is good guidance, is that there's an advisory that you should quarantine yourself for 14 days. I fully understand that you haven't done any, you've been, more or less in your house, and I do appreciate your service to our country very much. But there is going to be, however you decide to come home, whether you're going to drive home or whether you're going to go in a plane or whether you're going to come by train, however you're going to get here, you're going to be interacting with others on the way home. And the prudent thing to do is to follow the governor's guidelines and to isolate yourself for 14 days. Again, as a respect to others.
Yeah, and Peter, this is Jim McGovern again. Let me just say, I'm frustrated that wearing masks has all of a sudden become politicized and in some sectors a polarizing issue. I don't quite get it. For those who want to open up, if we all wear masks, I mean, the chances of us staying open are higher. And I tell people, the mask I wear is not a Democratic mask, and the masks my colleagues wear are not Republican masks. I mean, I wear a mask to protect you, and you wear a mask to protect me. And as Chancellor Collins said, it's a sign of respect for members of our community. I get it. I mean, we'd all prefer not to have to wear masks, and maybe we all look better without masks, although some have told me I look better with my face covered. But the bottom line is we're doing this because it's in the public interest, because it's a smart thing to do from a medical perspective. And if we want to open up our economy, which Mayor LaChapelle does, which the Secretary Keneally does, which Chancellor Collins does, we want to open up and keep it open. We have to understand that we have to follow some guidelines, and this is one of them. And it really isn't, a huge inconvenience. It's just a smart thing to do. Thank you.
Thank you. Our next question will come from Stacy from Worcester. Stacy?
Hi, Stacy.
Hi, Congressman, sorry. Maybe next time it'll be Governor. I agree with you, Governor. I think I look better in a mask, too. There you go. So my question has to do with tenant landlord. I have a house at the Cape that I rent in the summer, and then I have an off-season winter tenant. Her lease is actually expiring today, and I told her that I'm meeting a realtor tomorrow because I don't want, obviously I can't charge her $1,600 a week like I would my summer guests, and I canceled them back in May. But we didn't know what was going to happen 2 weeks ago, so I did say that let's look at it month to month. So she's going to stay, I think, I haven't read my emails, for the month of June. And she's already paid her last month's rent. Again, I'm very fortunate. But my question has to do with last week when I came to show the house. I feel that she was saying we couldn't do it safely. And my PPE consists of a scarf, a baseball cap, a mask, my goggles, and my graduation robe that the moths haven't gotten to yet. So and also it was raining, so I made sure I put baggies, bags, the grocery bags, on my feet and the prospective tenant. And then she sent a letter saying, after her mom's protest, well, let's go there. Her mom? Nobody can see their mom. Why is her mom there? Her mom lives in the same town. This is in Sandwich, Cape Cod. And I was like, and she said, the mom, I never saw the tenant. I didn't even know it was her mom. I have 2 sets of sliding glass doors. I put in the email how we were supposed to enter through one. That person, once she opened the door, go into the kitchen go into the kitchen to the front door, but open the kitchen door slider first. Anyway, I sent precautions, and none of them were followed, and I got a letter or an email from the tenant saying how what I was doing was not legal, and I have total disregard for their health. So can a tenant interfere with showing the house, even if you try and take proper precautions?
Secretary Keneally, do you have any comment on that?
Well, I think based on what you described you're doing, that sounds like a safe approach. And I'm not aware of anything in our laws now that would change the practice of how a landlord could show a property. We've had some laws passed around evictions and foreclosures and other housing matters specific to the state of emergency we're in, but I don't believe we've done anything that would alter that landlord-tenant relationship and your ability to show the property.
All right. Thank you.
Thank you. Our next question will come from Robin from Greenfield. Robin, you're on the line.
Hi, Robin.
Hi, how are you doing? And thank you for your work. We know that there's a second round probably coming with COVID. Have you prepared a plan for that? For instance, some places have 2 or 3 hospitals. Can't they put all the COVIDs in one hospital so the other one can be used for surgical procedures so other people aren't dying with emergencies? Do you have a plan for small businesses? There could be a protocol with one person going into the small business so they don't have to close. Also, protocol for self-sufficiency so that these masks and items that are needed for people to survive, having more factories open or manufacturers here in the USA. Are you starting a protocol for second round?
Well, that's a good question, but I think all 3 of our guests probably might have something to say about that. So why don't we begin with Secretary Keneally, then go to Nicole, and then go to Chancellor Collins.
Sure. The whole idea of having this phased, careful reopening strategy is to try to, as best we can, prevent a resurgence of the virus. And we hope that as we carefully reopen different activities in a phased way, we can do so in a way that we don't have the virus numbers spike again and don't run the risk of overwhelming our healthcare system. And one thing we're saying very clearly is that while workplaces are going to open gradually, we really hope people continue to work from home where they can. And so offices have been open now in Massachusetts since last week, except for the city of Boston that was open on Monday. But we're very much encouraging people to have staggered work schedules, to work from home where they can, and keep, frankly, as few people as possible physically in the workplace as we can.
Thank you. Nicole?
And as, dovetailing after Secretary Keneally, so this is a great example where the state sets really definite guidelines. On the local level, we're staggering all of our public safety and public work employees. City Hall is closed, and we're staggering employees there. And we're spending a lot of time working with area small businesses about how they can keep their employees safe to, prevent resurgence, as well as asking everyone to do their part and wear the masks and wash their hands when and if they have to go out.
Thanks, Mayor. Chancellor Collins?
Well, look, I think I'd say the following about a second wave. This virus has a mind of its own, and the virus needs us to replicate. So we play a very important role in preventing the ability of the virus to get going. I think that what we're all concerned about in the fall is, we go from outdoors back inside, so we get closer to each other. It's going to be compounded by the fact that it's quite likely influenza will be back, and so the symptoms are largely the same, so you don't know whether you have influenza or COVID. Our response to the second wave will be quite different in that we'll have much better testing. We'll have contact tracing, so we'll know if somebody turns positive who they've been in contact with, and we can isolate those people. We'll have much better access to PPE, which will make our healthcare workers more safe. And we have well thought out plans for how we can take care of large number of patients should they, need hospitalization or other kind of medical care. I do think the best thing we can all do is to follow the guidelines that folks have given us with respect to wearing the mask, social distancing, stay home if you don't feel well. I can tell you how many times I went to work with a cough and a sore throat. Won't do that this year. And if others do that, we should be much better positioned for a second wave. But as you said, Congressman, in 1918, there was a spring and it was much worse in the fall. And it really has to do with this virus's mind and how is the virus smart enough to change? We've already seen some evidence of that, where the virus in California looks a little different than the virus in New York. And if that continues to occur, then that could be a big challenge for us into the future.
Thank you.
Thank you. Our next question will come from Barbara from Pelham. Barbara?
Hey, Barbara.
Hi, Congressman McGovern. Thank you so much. I'm wondering about how can you hear me?
Yes.
Okay, I'm wondering about how the contact tracing is overcoming the problem of people not picking up calls that they don't recognize. Like my cell phone doesn't even ring if there's an unknown caller, and I did that to avoid spam.
I have a landline that I never pick up because that's the number I give to avoid getting calls I don't want to get. So, I mean, I imagine, you know, I could miss a call from a contact tracer, and I don't want to do that, but I don't want to open myself up to every random call.
So Nicole or Mike Keneally, do you have any response to that?
Yeah.
Nicole, Mayor
Yeah.
LaChapelle.
We're doing public education about those numbers, the phone numbers, and letting folks know that they're going to get that odd call, and please take a chance and pick up the phone. Contact tracing, especially in the cities, it's so important for us to map where the virus is going. And you know, I can't say enough of the virus has a mind of its own, and it's twisting and turning, and even on the local level, contact tracing is just so important and helpful to us.
Yeah, I agree with that, and it will continue to be a bit of an educational process. And just for some numbers, so since the state started our contact tracing strategy on April 12th, we've contacted 21,000 individuals and 17,000 of their contacts, so 38,000 people. In some cases had multiple calls, so there's been about 100,000 completed calls, if you will. But I agree with what you said in terms of the impediments to that program. And it'll just be an ongoing matter of educating the public about it.
Well, thank you, everybody. And I'm looking. It's now 5 o'clock, so I think that's we're at the point where I think that's all the time we have for questions. I just want to briefly say thank you to Secretary Keneally, Mayor LaChapelle, and Chancellor Collins for their expertise in helping answering questions tonight. We had a very high call volume, and we weren't able to get to everybody, but you can always call my office at 508-831-7356, or visit my website at mcgovern.house.gov to contact me directly. And if there's any unanswered questions, we will get back to you. But let me just end with this. You know, there's a lot going on right now in our country, and I know this is a challenging time for many of us, physically, emotionally, financially, and even spiritually. But look, our country has been through difficult times before, and there will be difficult days ahead, no doubt. But every time we face a challenge like this that seems impossible to overcome, you know, Americans always rise to the occasion. That's what's so great about our country. Nothing is written in the cards for us. We get to write our own story here. And we get to decide if we go back to normal after this crisis is over, or if we build something that's better than normal. And again, I want to build something that's better than normal. I think this crisis has shown us some of the deep inequalities and inequities that exist in our systems. We need to fix them. You know, we can listen to one another like we did during this town hall, and we can use our voices and our votes to build a better country for everybody. So I want to thank you all for joining us tonight. Stay safe, stay healthy, and most importantly, stay hopeful. Thank you.